Hello, welcome to our presentation on social determinants of health. We are Group 10 with Andrei Armena, Desiree Barrientes, Danielle Canales, Lilian Fernandez, Aurelio Gallegos, Alexis Mendez, Pfeil, and Racaza. Today, we'll be talking about a patient named Maria Luis. Her story shows how things like money, language, and immigration status and access to care can affect someone's health. In this presentation, we'll go over how we created a care plan for Maria, how we made sure the care was safe and high quality was provided, and how nurses can protect themselves while helping these patients. We'll also talk about how nurses can speak up for patients and how technology can be used to improve care. Maria Luis is a 58-year-old Hispanic woman who only speaks Spanish. She finished 6th grade back in her home country and recently lost her job as a housekeeper. She's undocumented and doesn't have access to many resources. She only uses a basic prepaid cell phone, so she can't go online or use any health apps. Maria has several health problems, including uncontrolled type 2 diabetes, high blood pressure, and early signs of nerve damage in her feet from diabetes. This is known as diabetic neuropathy. She needs regular checkups, she needs medicine, and she needs help managing her health. But there are many things getting in the way, like the cost of care, language, and limited access to care. Maria faces many challenges that make it hard for her to take care of her health. She has a low level of education and struggles with reading, so it's hard for her to understand medical instructions. She doesn't have health insurance or a regular doctor. Her neighborhood doesn't have healthy food, reliable transportation, nor does it have any safe places to walk or exercise. She also feels alone and afraid because she doesn't speak any English and worries about her immigration status. These things make her less likely to seek help when she needs it, and on top of that, she has no income and very limited access to technology, which keeps her from using health tools that could help her manage her conditions. To help Maria take better care of her health, we created simple and realistic goals for her. First, we'll connect her with a clinic that charges based on what she can afford, so she can get regular checkups and work on her lowering her A1C. This is for type 2 diabetes. We'll also help her sign up for programs that offer cheaper or free medications. To make sure she has the right foods, we'll link her to food pantries that offer diabetic-friendly options. For learning, we'll enroll her in diabetes classes taught in Spanish using easy words and pictures. We'll also teach her how to eat less salt to help with her blood pressure and how to check her feet every day to prevent problems from her neuropathy.
To improve the quality of Maria's care, we'll use Spanish language materials that match her reading level. These will include simple words, clear pictures, and examples that relate to her culture, like using familiar foods in meal plans. We'll also make sure she understands how to take her medications and manage her blood sugar. To give her the best support, we'll work with a team that includes social workers, nutritionists, and pharmacists. They can help her get food, understand healthy eating, and find affordable medications. We'll keep track of important things like her A1C levels, how often she picks up her medications, and whether she's going to her appointments. If something isn't working, we'll make changes to help her stay on track. Because Maria doesn't have internet or a smartphone, we'll send her short, easy-to-read Spanish text messages or call her to remind her about appointments and when to take her medicine. This way, she can stay connected to her care even with limited technology. As nurses, we also need to take care of ourselves while caring for others. This means always wearing the right protective equipment or PPE. This includes washing our hands and following hygiene rules to stay safe and prevent the spread of illness. We also need to keep clear boundaries with patients and families so that our care stays professional and respectful. If we see something that could harm a patient or staff member, we must report it through the proper channels. It's equally important to follow all safety policies set by our workplace and to document everything we do for the patient. Good documentation helps keep care organized, safe, and legal. Technology can help us give better care to patients like Maria, who face many barriers. To keep her safe, we'll make sure we use secure computer systems that protect her personal information. We'll also use digital tools to find out what kind of help she needs, like food, housing, or transportation, and to keep track of how she's doing over time. Even though she doesn't have a smartphone now, if that ever changes, we can connect her with simple apps in Spanish that can help manage her health. We can also guide her to community programs that teach basic phone or computer skills. This can help her feel more confident and involved in her care. Nurses have an important role in speaking up for patients who are affected by things like poverty, language barriers, or lack of access to care. These are called social determinants of health, or SDOH. When we see that these issues are making someone's health worse, we need to step in and help. That includes writing down what the patient needs and connecting them to the right services. We also make sure to treat every patient with respect, no matter their background. Using cultural humility means we take the time to listen and try to understand where they're coming from. This helps us give care that fits their values and needs, not just what we think is best.
Nurses can use technology to help close the gaps in care for patients who face challenges. We can write down things like housing or food problems in the electronic health record. So the whole care team knows what the patient needs. We can also use telehealth to check in with patients who can't make it to the clinic or hospital. For patients like Maria, we can send short-term reminders in Spanish to help her remember appointments, take her medicine, or check her blood sugar. It is important that we always keep her personal health information safe and private when we use any kind of technology. Being a nurse means we never stop learning. We'll keep our skills up to date by going to workshops, taking continuing education classes, and staying involved in nursing organizations like the ANA. We'll also use trusted sources like PubMed to find the latest research so we can give the best care possible. We're also committed to cultural humility, which means we listen to our patients and adjust our care to fit their needs and values. As technology keeps changing, we'll make sure to learn new tools so we can better help our patients from all backgrounds, including those with limited access or different languages. These are references we use for our project. One important source is the Berkman study, which explains how low health literacy can make it harder for patients to manage their health and leads to worse outcomes. This helped us understand why it is important to give Maria clear, easy to understand information. We also used guidance from the American Nurses Association on how to use telehealth safely, especially when working with patients who are vulnerable or underserved. Another helpful source was a 2002 article by Diaz-Teo, which helps talk about how nurses can stand up for undocumented immigrants like Maria by helping them get respectful care and equal access to health services. Thank you for listening to our presentation on the social determinants of health and how certain factors can affect individuals, especially those who are less fortunate in our community.